I think in the Americas, not just Northern America, here in the US, but we realize that a lot of places are there where there is lack of healthcare facilities, and the first areas we identified were in this Delta region, Mississippi Delta region. So we are now trying to improve the healthcare system in a particular area called Clarksdale, which is very close to Memphis in Mississippi. And that is where most of the African American communities live, and most of them are uninsured or underinsured. So they don't even come to the hospital because they know they cannot even co-pay. So that is the reason why we are improving the system there. We were running a clinic for last 7 years, free clinic. It was giving medications, lab work, as well as consultancy for consultation for all the patients for free. And even we had bus to pick them up and drop them, many of them who were not able to come. But with the local county hospital, now we have worked out a program for mother and child services. And we are improving and upgrading the existing hospitals' mother and child services by giving them $1 million grant that has helped them to buy new equipment and also upgrade the facilities there. So I'm here basically going tomorrow to Clarksdale to inaugurate the center. It will be called Sri Sathya Sai Center for Mother and Child. Yes, in DC, we are doing a different program. The same kind of an issue in the inner cities and rural areas of America, where the youngsters are kind of left behind. They don't finish schooling, or even after they do finish schooling, they don't go to college, or they're college dropouts. So what we have tried to do is basically we have tried to digital educate them, in the sense give them some skills based on the digital economy, like AI, cybersecurity, data analytics, and things like that. Now these youths get trained for 6 months or so under the workforce development program, which are local programs, and then they get placed into companies, or they work with our institution called People Shores, which gets job and work from other bigger companies. So they work on live projects after that, and they get used to it. And after a few more months or a year, they get acquainted with those kind of industry practices, and then they are getting mainstreamed. Some of them who were burger flippers and taxi drivers, they have now got jobs in Morgan Stanley and places like this, Accenture and stuff like that. So that is another program. So we came to here to open the 7th People Shores Center in Washington, D.C. area. We have other centers in Clarksdale, one center in Arkansas. We have got in Atlanta. We have got 2 in Brooklyn and the Bronx. And here now we are opening this center. And we also have one in Tampa Bay in Florida. So these are the centers, and our plan is to open more centers which will help the marginalized youth to acquire the skills necessary and become mainstreamed. US definitely has one of the best healthcare systems in the world. There's no doubt about it. They're far ahead in terms of their research and quality of healthcare delivery, their protocols and other things. But it's not equitable healthcare. It is not available healthcare to all. It's not affordable for all. And that is the kind of the other side of US healthcare. So we figured this out, that for those who are not well insured, or those who are from very marginalized communities, the poor communities, they don't even go to access healthcare because they cannot afford it. And that is where we think the US healthcare system has to kind of rethink its strategy to truly become a universal healthcare system for the marginalized. So in rural healthcare systems, I've noticed there are a lot of gaps. When there's no professional expertise in most of the places, specialists are not there, and the system is quite old, or the buildings are old, equipments are old, they have not been refurbished for a long time. And I think the general awareness, the health-seeking behavior of people in the rural areas of America is missing. Because when we even try to go and tell them and try to encourage them to come for a checkup, which is free, even then there is some kind of hesitation, maybe out of the fear that what if they're diagnosed with something which they cannot afford to treat? Or the second thing is that, it's just a casual feeling that I don't need to check myself. I think this health-seeking behavior is also lacking. And that should have been a part of the community healthcare education programs of the government, outreach programs where we include them into, learning about their own health habits. But I think that's something we can. These are 1 or 2 things that I would insist. One is that I think specialists are required in the rural healthcare. I know that it's difficult because it's not very profitable to be in the rural system, but then somebody has to go back for them. So some policies that would encourage people going back, or through technology or in some other way, access to the healthcare in the rural area has to be improved. And the second thing I think it's very important is to create education for health-seeking behavior in the rural communities. That has to be a part of the regular education programs, family health programs, and community health programs. I think some investment there would go a long way. These are my impressions from the immigrant communities, the African American communities, and those minority communities. That's where I've seen these things. I'm sure it might be different from the regular ones.